Here to dive into industry trends with leading ETF experts, this is ETF Spotlight with Nina Mishra.
Hello and welcome to ETF Spotlight. I'm your host Nina Mishra. My guest today is Travis Briggs, CEO of Robo Global. Robo Global created the index for the first ever robotics ETF listed in the US. It's the Global Robotics and Automation ETF, ticker Robo. They recently launched the Robo Global Healthcare Technology and Innovation ETF, ticker HTEC or HTEC, which provides exposure to global companies leading the healthcare technology revolution. And of course, we have seen a lot of innovation in the healthcare industry. Advanced technologies like AI and robotics are transforming this space with the disruption in diagnosis, regenerative medicine, robotics, genomics, DNA sequencing, and smart monitoring devices. Travis, welcome and thanks for joining us.
Thank you, Nina, for having me.
Okay, so tell us why you decided to launch this index, which is based on healthcare technology, and what does this index aim to achieve?
Sure. As you mentioned at the opening, over 6 years ago, we launched the first strategy to market that focused solely on AI, automation, and robotics. And really for the next 5 years, we focused all of our efforts on understanding and monitoring the changes in that space. And it was really about 2 years ago we recognized that healthcare, which was a part of the initial index that we put together, that the healthcare sector was really on the cusp of what we thought would be significant disruption. And we see that for a number of reasons. One, the global healthcare industry is not only non-cyclical, but it's huge. Right now, as many of us know, it's the largest spender in healthcare as a percentage of GDP, almost 18%. Mm-hmm. That's about $1.7 trillion, and I think over almost 17 million people employed. And that's not just the U.S. In the U.K., you have the NHS, or the National Health Service. It's the fifth largest employer as well. And what's occurring is the system that was originally set up, doesn't really work anymore. Healthcare is just becoming too expensive and to a point where I think it's really unsustainable. The second driver really is, that the healthcare industry has been very reluctant for a number of reasons to really move from analog, if you will, to digital, right? And so if you look across the different sectors in the economy, it's one of the least digitized sectors, and it's really one of the sectors we believe that's most ripe and will benefit the most for it. So basically, we designed an investment strategy that will benefit from this transition from analog to digital. We've identified all the subsectors within healthcare that we think are poised for extraordinary growth as you move into a world that goes beyond just treating the sick, but has the ability to predict, really, prescribe individualized processes and ultimately get to a point where you prevent. And the only thing that I would add on that is when you asked me what the index aims to capture.
Okay.
So we really, the 9 subsectors we've identified, really we're looking at all those areas, and we expect to capture essentially the disruption that's going to happen within the subsector or within the healthcare industry, and generally to try to capture those companies that are going to benefit from it for the benefit of the investor.
Okay, great. So I wanted to talk a little bit about the healthcare robotics market first. So the world is short of surgeons, and that is according to the Financial Times. 143 million people worldwide are denied operations each year, and 5 billion people lack access to safe, affordable surgical services. And of course, training surgeons is very expensive and time consuming, but robots and other autonomous instruments, they could eventually perform many medical procedures, and they can also help standardize some of the procedures and help surgeons. So we are still very far from total robotic surgeries, but AI and machine learning, they can really help surgeons. And I noticed that Intuitive Surgical, which is one of the pioneer in this space, is a constituent in the CTF. They are behind the Da Vinci surgical system, which enables minimally invasive surgery. So could you tell us a little bit about the healthcare robotics market? How are robots changing this space?
Certainly I will. And as you know, Intuitive Surgical and other robotic surgeries have been a part of our initial strategy 6 years ago. So we've been following it very closely. Basically, robot-assisted surgeries will be the next decade advancements in minimally invasive surgery. Right now, surgeons all over the world are using robot platforms for orthopedic, prostate, and other procedures. Essentially, the robotic surgery and the advancements that's been made there translate, really better outcomes for patients, and it leads to shorter hospital stays, which ultimately lowers the cost for healthcare providers. What surgical robots are, for those listening that don't know, they're not actually robots that operate independently.
Right.
They are robotic instruments that a doctor operates, that has historically operated from within the operating room, and I'll get to a new advancement in that a little bit later. But the doctor operates the robots, via machine controls, and what that allows for is it's less invasive, and it enables physicians, maybe surprisingly to some, but it enables them to have way more control over their surgical devices or their scalpels or lasers, or whatever they happen to be using. It allows them more control, flexibility, and precision than conventional methods. And really to validate this, Intuitive Surgical that you mentioned, they received FDA approval back in 2000, and really through the first 15 years, continually advanced, sold more, and I think in 2015 they performed 500,000 surgical robotic surgeries. In 2008, 3 years later, they performed over 1 million.
Wow.
So, as you highlighted, there's a number of reasons why that's occurring, but two big ones is the shortage, the skilled shortage, the better outcomes, and the technology advancements in the space. The only thing I would add to that, as you think about the growth, is currently it's about a $5.5 billion market, but it is expected to grow at over 20% between now and 2025, which will surpass about $24 billion in annual revenue by 2025, which I think is identified as a very good growth opportunity for investors.
Yes.
So the one thing I was going to point out that you mentioned, which I think is an amazing advancement and has serious and positive implications, is they just performed the first remote robotic surgery. The doctor was located 20 miles away from the actual surgery and the patient. As you can imagine, there's all kinds of technology latency issues that occur with that distance. But as 5G comes on and the technology continues to improve, you can imagine a world where a doctor could operate anyone from anywhere, and that would certainly be a better world for us, all of us.
Yeah, definitely. The space has amazing potential. And another area within the healthcare space, which I find very exciting, is gene editing and CRISPR. And last year, a Chinese scientist had reportedly created the world's first gene edited babies. So, of course, there is ethical debate about human gene editing, but the technology has excellent potential, especially for dealing with inherited genetic disorders. So, can you talk about some other key growth areas in the healthcare space and why investors should not ignore this space?
Sure. Since you had mentioned the genomic side, I'll start with that.
Sure.
The index really was designed for, in addition to the other subsectors, the genomic subsector, we really tried to capture the entire value chain of the field. And how I would put it simply is, that we all recognize medicine affects people differently. And now the advancements in genetic data has really given us kind of a roadmap as to why. With the ability to sequence the human genome now, it's possible to predict, diagnose, and even treat disease on a much more precisely and on an individualized and personal level. When you think about the broadening reach of genome sequencing, you're making it cheaper and faster, which is allowing for a better understanding of not only major diseases, but also, the rare and chronic diseases. There's a few companies within the index, Veracyte and Exact Science. They're targeting cancer detection through non-invasive and pain-free methods, such as a nasal swab or a sample. There's also, if you want to go on the CRISPR side, there is trying to think. Intelia is creating a cell-based gene therapy to find a cure, and so since the genome was sequenced over 15 years ago, and the advancement and that we've seen in data analytics and AI, there's just going to be enormous changes. And I guess speaking of AI, and you asked, some of the growth areas, AI, as it's typically referred to, or machine learning, this is what it primarily is right now, indeed machine learning. But with the advancements in machine learning, the AI is now basically touching every single point within a patient's within a patient's process throughout the medical system. I was going to find that. What was that? Oh, Accenture said healthcare AI is poised to grow 11 times by 2021 to 6.6 billion. It is by far the fastest growing area within healthcare, and primarily because it overlaps in so many different areas. To give you an example, radiologists are using AI in detecting diseases, surgical robotics, genomic analysis, drug discovery, clinical trials, and even the smart monitoring devices that are helping on the preventative side of healthcare.
Okay, so let's talk about your ETF now. Let's take a look at the Robo Global Healthcare Technology and Innovation ETF. The ticker again is HTEC. So could you tell us how holdings are selected and weighted in this index?
Yeah, sure. One of the things we originally did with the first index we created for robotics and AI was really to scan let's figure out how we're going to classify the space, right? Because back then there was no quantitative models. You couldn't type in, hey, find robots. We had to start from scratch. With healthcare, it was a little different. We still started with the research process, but as you know, healthcare is already a well-defined and a growing sector. So we did kind of segment healthcare into 9 subsectors that I mentioned earlier that we think are poised to growth, are poised for growth. So the proprietary classification we created, really is designed to not only measure a company's purity, but also some other factors that I'll mention shortly. But essentially, the 9 subsectors that we identified are the ones, some that we've mentioned: genomics, robotics, diagnostic, lab process automation, telehealth, regenerative medicine, medical instruments, precision medicine, and one that is, has traditionally not been, but certainly is right in the middle of healthcare right now, is data analytics. Mm-hmm. So that's kind of the research driven. That's how we've defined the landscape, trying to capture the entire value chain. And then I would say, how do the constituents actually make it in? So we use a modified equal weighting system. Okay. And in the score, it's basically the weighting system. Usually ranges. It depends on how many names are in or names go out. But the weighting system will range anywhere from 60 basis points to 1.5% to 2%. Okay. And the ranking is really driven by 4 things initially, and that is revenue purity, right, which I think is self-explanatory. We also measure the technology amongst its peers. Is this an aging technology that has a lot of market share, or is this a new and emerging technology within the space that does not have a lot of market share, but we see as being the dominant technology? Of course, the other one is market leadership. Where are they within their peer group on the ownership of the market? And then the fourth is investment. How much is this company focused on increasing their revenue purity into the particular space that we've identified? You can capture that through CapEx, R&D, and even M&A. Okay. Once we have a quantitative ranking or a ranking off of those 4 factors, we do look at a couple of quantitative metrics in healthcare, and especially emerging healthcare. We want to make sure that we are keeping an eye on not only valuation, but also leverage, or what I call capitalization.
So I see there are 86 holdings as of now. And among the top holdings, I recognize some of the companies. I know a little bit about them. These are some of the very innovative companies in the healthcare space. One of the top holdings is Genomic Health, ticker GHDX. It develops genomic-based clinical trials for cancer diagnosis that allows physicians to offer individualized treatment options. Then I see Integra Life Sciences, which is one of the world leaders in regenerative medicines. Teladoc Health is there, ticker THDC, which is a leader in virtual care. I see Dexcom there, which is known for its continuous glucose monitoring system. So tell us a little bit about some of the top holdings that you like, and also tell us why they are in the index.
Yeah, sure. I'll start with one that we're excited about, and think it is, has a lot of growth potential, and it's also in that subsector I mentioned that's maybe not traditionally in the healthcare space, and that's data analytics. Tabula Rasa is a small provider of basically proprietary software that is able to analyze multiple prescription drug interactions on an individual level to help reduce adverse effects. So I'm not sure how many are aware, but a wrong diagnosis or an adverse response to an inappropriate drug is responsible for thousands of medical deaths a year, and really through data analytics, Tabula Rasa is right in the middle of all the three critical drivers of healthcare, which is they're incorporating the digital technology, they're dramatically improving the individualized quality of care, and it's also simultaneously lowering costs. It's headquartered in New Jersey. It's got in 2019 projected 39% growth. It's about $1 billion in revenue, and I think the simple way to think about it, it is able to provide individual drug treatments, for every unique individual's specific needs.
Okay.
So that's one in the data analytics. Another sector, when you ask me about exciting areas of focus, one that certainly comes to mind is telehealth.
Right.
There are a couple companies I could cover in the telehealth sector, but essentially one of them I think we'll go over is Ping An. It's headquartered in Shanghai. It trades on the Hong Kong Stock Exchange. It's about a $6.5 billion revenue company. $500 million revenue, $6.5 billion market cap. Recently got another, I think, over $1 billion investment by SoftBank, who I'm sure many of us are familiar with. It is China's leading virtual care provider. Essentially, it provides 24/7 online virtual care. It has over 265 million registered users, which logs in about 55 million active users each month. So, Nina, as you alluded to earlier, the shortage of skilled healthcare workers and the increasing healthcare costs, this is a perfect example of being able to use technology for patient doctors to communicate. A good way to think about telehealth is, there are numerous afflictions that we go into the doctor to see, whether it be a stomach ache, runny nose, strep throat, the non-emergency type events that could be handled so quickly and easily over the phone, saving a lot of money in the process. For those investors listening and interested, the largest the U.S. market leader is a company called Teladoc, which is also an HTEC index company that we think very highly of. Another one that's outside of that, and it's in the medical instruments, is a company called Dexcom, which I think you briefly mentioned.
Yes.
Dexcom's really interesting. They make implantable devices that continuously monitor the glucose for diabetes management.
Yes.
Right now we have a serious issue with the increasing number of chronic diseases, and diabetes is one of them. And so it's a growing market, and this device will allow individuals to constantly monitor glucose 24 hours a day and inform patients, whether it's too high or low, rather than the traditional process of having to stick your finger for blood, on a regular basis. So, I would consider that a much better patient outcome. And again, what that is a great example of is the continual monitoring, really will alert diabetics to a potential problem rather than waiting till they have the problem and dealing with that. Does that make sense?
Yes. Yeah.
Yeah.
Very interesting company.
Yes, it is.
Any other holding you would like to talk about?
I think maybe the last one that's on the falls under the umbrella of the genomics, not particularly genomics, but is Qiagen. It's a diagnostics company.
Right.
It's the world leader in molecular testing solutions. It's about $1.5 billion in revenue. It has a sizable and growing portfolio of diagnostic tools to determine if a patient has appropriate genetic makeup for a specific genetic therapy. Essentially, it has assays that allow for a much more granular look within a patient, and it really allows just through blood tests to identify genetic information, of possible gene mutation or a pathogen, and it's just a much more sophisticated technology that's really only with the advancements in AI, it's just really becoming a very relevant and I think growing company. The one thing I would say is Qiagen's perfect example is one size does not fit all. Right, we all have different genetic makeups, and this allows us to identify those through individual assays and blood tests.
So these are all very innovative companies, and I think the ETF provides an excellent way to get diversified exposure to these companies powering this healthcare technological revolution. And as you mentioned earlier, we are in the early stages of this revolution because healthcare is one of the least digitized sector among all sectors. So there's obviously a lot to be done. Anything else you would like investors to know about this ETF or robotics or your robotic ETF in general?
Yeah, I think the best way to think about it is healthcare is really and the process has already begun transforming from an individualized process to a predictive business model, or transitioning to an individualized predictive business model versus just a traditional fee for service way it's been operating. The future of healthcare is shifting, as I mentioned, from analog to digital, from really treating the sick to predicting and prevention, and from a shortage of skilled healthcare professionals to robot and AI-assisted technicians. I think the benefits will be numerous. There'll be lower costs, increased efficiency and productivity. And most of all, I think the most important is better patient outcomes for all. So our strategy, the health tech strategy, is designed to capture those advances or those growth in the development in this sector, and we think that will result, or we believe that will result in substantial growth opportunities for investors.
Okay, excellent. That's all we have time for today. Travis, thanks again for joining us.
Nina, I appreciate the opportunity. Thank you.
Thanks for listening. If you want to learn more about these ETFs, please visit roboglobaletfs.com. Make sure to be on the lookout for the next edition of ETF Spotlight, and also make sure to subscribe. If you have any comments or questions, please email podcast@zacks.com.
This material is being provided for informational purposes only, and nothing herein constitutes investment, legal, accounting, or tax advice, or a recommendation to buy, sell, or hold a security. Do not act or rely upon the information and advice given in this podcast without seeking the services of competent and professional legal, tax, or accounting counsel. Publication and distribution of this podcast is not intended to create, and the information contained herein does not constitute an attorney-client relationship. No recommendation or advice is being given as to whether any investment or strategy is suitable for a particular investor. It should not be assumed that any investments in securities, companies, sectors, or markets identified and described were or will be profitable. All information is current as of the date herein and is subject to change without notice. Any views or opinions expressed may not reflect those of Zacks Investment Research as a whole.